Obstetricians ask what the technical skills are that they need to work for MSF. A lot of the patients arrive very late and in critical condition. So I think the three main areas where obstetricians can improve their technical skills are in surgery, so in the general surgical sphere, in the care of critically ill, critically unwell obstetric women, and also in their obstetric skills. And the good news is that we have the capacity to be able to train people and teach people in these skills. Every year we run a training in Düsseldorf in Germany on advanced obstetric skills. The biggest component of that training is actually in surgical skills, so that takes up 2 days of the training, and we have 3 experienced MSF surgeons who come to teach the obstetricians about surgical skills, concentrating specifically on bowel surgery, injury to the urinary tract, vascular surgery, and also general damage control surgery. The way the training's structured is that there's a theoretical component, a teaching component, and that's followed by a practical component, initially with people doing training on models, and then on the second day we train on cadavers. The feedback we've had has been really positive. People feel like then if they do come across these situations in the field, they feel more comfortable and more confident with being able to manage this type of situation. One of the things that I always really notice in the field when I'm there is that you need to become much more aware of the whole patient. You need to be able to broaden your horizons. You may not have that support. So as a result, another big component of the Düsseldorf training, a full day is spent on caring for critically unwell patients, and we have MSF anaesthetists, intensivists who come to train on that subject so that we can find that we're all speaking the same language in the field, and also to help obstetricians if they do need to manage resuscitation to be able to do that more effectively. When people come to the Düsseldorf training, they've usually done at least one project with MSF in obstetrics, but often those projects are very different. So we looked at topics like induction of labour, caesarean section, postpartum hemorrhage, and management of complicated cases in the field. And one of the important things as well is that people can bring their own experiences and bring their case studies of difficult cases they've had to manage. And someone brought up the case of some quintuplets that we had in the field, so 5 babies, and the question of how they should be delivered. I'm not sure, having never seen a case of that in Australia, what the answer would be here, but I suspect once we usually get to triplets and beyond, we're looking at caesarean section. However, these babies were premature. We know that babies that are premature, unfortunately in MSF fields, often don't have a very good chance of survival. And so there was a lot of debate and back and forth amongst the participants about what is the appropriate way to deliver these babies. So it's a really interesting occasion and a really great opportunity to share our experiences, and people can take away from that and go back into the field with that knowledge and that collegiality of that experience. So my advice for obstetricians that thinking they might like to work for us is go for it. It's undoubtedly incredibly challenging. The women and the babies that come to us are often in very critical states. They've often gone many places and travelled great distances to seek out medical care because of lack of access. And it will challenge your skills, and we know that. And we have a whole network of capacity in trying to support you to make sure that you can provide the best quality of care that's possible.